Good afternoon, and welcome to today's Inclusion Works Lunch and Learn series, Empowering Employment for Individuals with IDD through Benefits Counseling, Part 1. Before we get started, here are a few reminders about the webinar. Please make sure you're using a computer or smartphone connected to the internet, and the audio function is on and the volume is turned up. Please be sure your microphone is muted for the duration of the call unless you are speaking or asking questions. To ask questions, use Q&A feature located on your control panel, and we will answer as many questions as time allows toward the end of the presentation. For closed captioning options, select the closed caption feature located on your control panel. To adjust your video layout and screen view, select the View feature located in the top right-hand corner of your screen and choose the view that works best for you. If you're using a mobile device, the location of the Zoom controls may vary. The Q&A feature may be located at the top of the screen instead of at the bottom. Today's agenda topics include introductions and an overview of competitive integrated employment. This will be followed by common misconceptions about employment and benefits and a discussion on benefits counseling. There will also be time for questions after the presentation. At this time, I'd like to turn it over to Tina Barrett, IDD Team Lead for the IDD, TBI, and Olmstead section of the Division of Mental Health, Developmental Disabilities, and Substance Use Services.
Thank you, Dina. Carla, could I have you advance the slides for me, please? Another one? One more. There we go. So thank you so much and welcome everybody for joining us today. We're glad to have you here. I'm Tina Barrett. I'm the IDD Team Lead for the Division of Mental Health, Developmental Disabilities, and Substance Use Services, and part of the IDD, TBI, and Olmstead team. I'm happy to have with me today Pablo Puente, I hope I pronounced that right, who is the Special Project Manager for Employment Source. And also we have a special guest of Keena Farrington, who is a Community Work Incentives Coordinator, also with Employment Source. They will be answering some questions about benefits specifically later on in the presentation. Next slide, please. So for an overview today, this is session one, which is our session one of our part 2 Lunch and Learn webinar series, which provides a deep dive into the benefits of counseling and work incentives. Today, we are looking at understanding benefits and employment, the relationship between employment and benefits for people with IDD, an overview of benefits counseling, as well as an opportunity for people to ask a benefits counselor. So we're glad to have Keena with us here today. Our next session will be December 4th, and that will focus on navigating benefits and employment in real-world experiences. And it will include benefit employment eligibility and information around Medicaid, Social Security, and SSDI, as well as WIC and SNAP, ticket to work incentives, strategies to maintain benefits while working, as well as some individual testimonies and question and answer there as well. All of the slides will be attached to the invite, and the recording will also be made available on the Inclusion Works website following the webinar. Next slide, please. So understanding competitive integrated employment. What is CIE and who does it include? So the Workforce Innovation and Opportunity Act, which is often referred to as WIOA, defines competitive integrated employment as people with IDD who perform work on a full or part-time basis and are also compensated at or above minimum wage. They're paid comparable wages to employees without disabilities who perform similar duties and have similar training and experience. They receive the same level of benefits that are provided to employees without disabilities who are also working in similar positions. They work at locations where employees with disabilities interact with people without disabilities. They're also presented the opportunities for advancement that are similar or considerably the same as other employees without disabilities in similar positions. Next slide, please. So some of the benefits of competitive integrated employment. Here at the Division of Mental Health, Developmental Disabilities, and Substance Use Services, we do feel that everyone has a right to work if that is what they choose to do. For those people who are choosing to work in the community, there are several benefits for participating in competitive integrated employment. On average, people who work in CIE jobs earn more money. They are making at least minimum wage, and their salaries should be commensurate with those who are without disabilities who are working in similar jobs. They are building more relationships with people who do not have disabilities, because working in CIE does allow an individual to interact more frequently, build better social relationships, and contribute to a sense of belonging and purpose. They also have increased skills because engagement in CIE is linked to improved confidence, focus, personal independence, and developing skills in self-determination and self-advocacy. People working in CIE are also more integrated into the community. They have more community integration and inclusion, and their overall quality of life is enhanced due to the access to broader social and economic opportunities that CIE provides. So next slide, please. So many North Carolina employees have benefited from the talent that's provided by people working in CIE. Primarily, you can see on the left-hand side of the slide, the pie chart, the different types of occupations that people with CIE are working in. 41% are building and ground cleaning maintenance types of crews. 20% is in food preparation and serving related fields. Office and administrative support is also provided. There's production, transportation, material moving, personal care and services, construction, extraction, sales. So people working in CIE work in a variety of different types of jobs and tasks. You can see on the right-hand side of the screen, several different types of places that do employ at CIE include places like Food Lion, Harris Teeter, and Burger King, amongst others. So we have a lot of North Carolina-based employers, who do include people with CIE. Next slide, please. So employment and independence for people with disabilities, which is EIPD, and supported employment services can support people with IDD find a CIE job if that is what they choose to do. So EIPD, which has previously been known as rehab or vocational rehabilitation services, should be a person's first point of contact before they look at supported employment services. EIPD helps people with disabilities develop a customized path to employment, and that can include career counseling, education and training, job placement assistance, medical treatments, and assistive technology. For eligibility requirements, people can reach out to their local EIPD office for a referral and get started on the path to CIE. Supported employment services help people with IDD live and work independently in the community. There are multiple options that are available, and they're dependent on eligibility. So certainly Medicaid 1915I supported employment services are available to Medicaid recipients who also complete the 1915I assessment. State-funded supported employment is for non-Medicaid recipients with an IDD diagnosis. They would also complete the NC SNAP, ASSIST, a TBI, or vocational rehab assessment, and have at least one functional impairment. And then the innovation waiver supported employment is also provided to Medicaid recipients who receive the innovation waiver. Accessing employment services can be done through your local EIPD office. We also recommend that you reach out to your tailored care manager or to your regional tailored plan to help get the process started. If you're not sure about which service option is right for you, there is a Path to CIE guide that is available on the Inclusion Works website. It is an interactive tool that will walk you through finding a job and the steps involved with that, and explain some of the support options that are available. If you have not had a chance to look at that, it is a great tool as far as getting started and walking through. So I am going to, next slide, please, Carla. I am going to hand this over to Pablo to provide some information about common misconceptions about employment benefits. Pablo? Pablo, you're muted.
Thank you, Tina. Thank you. Thank you for that introduction, and I'm very happy and excited to partner to this webinar. So we at Employment Source, we're trying to brainstorm and see what are the most common misconceptions when people are going through, trying to get into employment and moving into competitive employment. They might have multiple questions. Most of the individuals receive some type of disability benefit, right? We're talking about disability benefit could be SSI from Social Security, could be Medicaid from Medicaid as well. Sometimes Medicare, food stamps, and so on. So when you are moving into competitive employment, one of the most common question that come to us as a benefit counselor is what's going to happen with the benefit, right? So I have 5 misconceptions here that we heard that are the most common one. We'll be glad to maybe if you have another one and just maybe open up later and share it with us so we can talk about it. But I'm going to start with if I go to work, I will lose all my benefits, right? So a lot of people, in some way, were spending a lot of time getting documentation, going to the agency, and finally they get into benefit, right? They finally get into Social Security that sometimes take years to get in. It could be Medicaid and Medicare sometimes, the waiting period of Medicare is long. So there's a lot of people spend a lot of time and resources doing that. And then when they face the question, I'm going to get back to work, I'm afraid of losing that, all the time invested, all those resources. So it's very common that come to what I said and said, if I go to work, if I start working, I will lose all my benefits. So the first thing I want to say about this is benefits in general are is a system that support a person while the person is disabled, right? So that's why we need that extra income maybe from SSI. We need that those healthcare benefit from Medicaid or Medicare and so on. So when you went to the agencies and got those benefit, they were the benefit that you're receiving are come from different agencies, right? So, for example, it's a very common situation an IDD individual might have SSI, might have Medicaid, and food stamp. I'm just going to start with those 3 to make it a little simpler, right? So SSI come from an agency called Social Security Administration. And when you apply to that, you had to meet Social Security Administration rules for the program, right? So eligibility for them. So, and then you have another agency called Medicaid state in this case that is providing you SSI Medicaid, right? The Medicaid that come with the SSI program. And then DSS, you went to DSS and you get food stamps. So those are 3 different benefits from 3 different agencies with 3 different rules for those programs and eligibility. So when you start working, you will start generating some income, right? Earning some money. And also possibly you're gonna accumulate some resources, right? Now, each agency have their own standard. So when you're trying to get or you're getting back to work, it's very hard to lose all your benefit, right? Some benefit might be there and might not be affected at all with your job. Some of them might be partially affected. For example, the SSI benefit normally is reduced with earnings from employment, and some of them could eventually be eliminated, right? For example, food stamps, right? Food stamp is a benefit that's very sensitive to earnings, but you're making more money too. So in some way, it's a trade-off, and that's why it's important to have this conversation with a certified benefit counselor, right? They can show you all these different scenarios, and we can review the program. We can talk about the program with Social Security, the program with Medicaid, and in this case with the food stamp program, and give you all the explanation, the rules, and all this program had different income level and resource level, right? So it's a combination. I know it's maybe a little complicated to keep all this in your mind, but that's why you need a benefit counselor. That's why we are here, right? That's why we are available to help you with these questions. So, and another very important point that I want to mention is work incentives, right? So when we start working, this program has available what is called work incentives. Particularly, Social Security has several work incentives, depends on the program, and depending on the program, and those are special rules that allow you to keep your benefit for some time while you're moving into employment, right? So, for example, a very common one, and you might have heard, is called the trial period, right? So if you are in the SSDI program, you will have at least 9 months to earn as much as you can, and there is no limit on that one, and keep your benefit. So this is an example of a work incentive. So work incentives are special rules in some way, or wild cards that you get to keep your benefit while you, oh, I'm sorry, keep your earnings and benefit while you're working. And then you will see if this is working for you. Because when you're starting to work, you have different issues that you had to face, right? You have transportations, maybe getting you had to learn a new job, learn a new skill. So it's a whole process that you had to walk through while you're in the job. So Social Security will say, well, you know what? Worry about that. We want to give you some work incentives for some time. Everything's going to be on hold. You're going to get your benefit. You're going to get your paycheck. Figure that out with employment first. So again, those work incentives, I said several of them. So some of them from Medicaid, some of them are for Social Security and so on. So those are the work incentives that a benefit counselor can show you and say, well, you know what, you might be working, but for this period of time, you will be fine. Then after that period of time, you might decide if this is good for you. You want to continue, you want to maybe reduce your hours, maybe increase your hours. So that's when we discuss little strategies as well. All right, I think let's move to the next slide, please. All right, another very common misconception is if I lose my benefit, I will not get them back, right? So that basically tells me that this is kind of like a one-time deal. If you did something that was not appropriate, everything is gone. Well, the reality, it is not like that. So even though there are some situations that your benefit could be terminated and you might have to start all over again from the beginning, right? I'm not going to say that doesn't exceed the situation. When you talk to a benefit counselor, we can first explore where you are with your benefits, right? Sometimes benefit get what is called suspended, right? Suspended means that you're still in the program. You apply to the program, you get into the program, you started working, but something happened and make your benefit to be on hold, right? So you don't get the benefit at that time for some reason, but it doesn't mean you are out of the program, right? You're not terminated. You don't have to start all over again with the application. You just something happened that you had to do in order to get your benefit back. At least Social Security and Medicaid has several what is called safety nets, right, for benefits. So those are instances when maybe your earnings are going a little too high, or maybe your resources are going a little too high, things that you can get into those situations where your benefit might be on hold for some time until this situation is back to the eligibility criteria and you get those benefits back. So I would say this is very, very common misconception. Other people get afraid and said, I'm gonna lose my benefit. Now, I wanna add to that being able to contact a benefit counselor on time, right, early in the process is very important. So we can discuss all of these possible issues that you might face in the future and sometimes how to avoid these issues, right? So maybe we don't want to be in a situation of suspension, or we want to be in a situation that a benefit continue and those benefit, I need those benefit and I need my salary to sustain myself and keep my life, right? Another important situation that I see with this misconception is it's possible that you might have to move from one program to another program in the same agency. For example, Medicaid is a very common situation that you might start with what is called SSI Medicaid, right? Which is the Medicaid that you receive because you're an SSI eligible person. And eventually you start working and you're making enough money and maybe you lost the SSI Medicaid, but Medicaid give you the option to move into another program. For example, the health coverage for workers with disabilities, right? So those are two different programs in Medicaid that are connected. Your situation in benefit was, for example, A, right? Now you're moving to B. It doesn't mean that you're not in benefit. It just means you move from one benefit to the other one, right? So you kind of were able to hop from one program to the other one because your situation changed. You're working now, right? You're making money. So let's be honest, sometimes it's not a bad situation and life moves us in a situation that you are making enough money that you might not need some of the benefit, right? But it doesn't mean that you're not going to have all the benefit available to you. So that is another situation that benefit counselor can help you with when we are foreseeing that very soon you might not be eligible for this benefit, but there's another one out here that you can move into and continue receiving those benefits, right? And this is very connected with, again, what I just said is called the benefit planning and benefit management, right? So we kind of discuss the strategy with you. What do you want to do? What is the benefit that you must maintain in order to keep your life moving along, right? In this employment process, because again, you move, you might accumulate some resources, you might have some savings, you might have an extra income, right? And that is nothing wrong with it. We just need to how to play that situation and move you into the benefit that help you to continue moving forward with your job and your career. All right, Carla, can we move to the next one? All right, misconception number 3. If I went to the Social Security office and a representative told me, this is very, very, very common. And I'm going to be honest with you, it's a little confusing because when we go to the Social Security office, let's say we're receiving Social Security benefit, of course, right? And I receive an SSDI or SSI, and I go to the Social Security office, I ask a question and I get an answer. Well, obviously, I would say that's the answer, right? A Social Security person gave it to me, so that is the answer. All right, this is a huge, huge misconception, but when we go to the Social Security office, very few people in the field office is trained in disability benefit. They might not have that extra training to answer more I would say more in-depth questions or more fine questions. They might have a good understanding in general, maybe high level, what disability benefits are and how they work. But when it comes down to the individualized question, your personal question, your specific situation, they might not have all the training and knowledge to do that. So when you go to the office, most likely you might have specifically to ask for those trained people that can give you those answers. And if we don't know this, right, we go to the office, we ask anyone and somebody tell us something and we believe that is correct. So we have a lot of people, a lot of clients that come to us, they say, I just came back from the Social Security office and they told me such and such thing. All right, so I know that sounds a little confusing, and agencies like ours, so in North Carolina at least, there are 2 agencies that provide benefit counseling services for Social Security beneficiaries, right? So one is EIPD, right, mostly in the western part of the state, and ServiceSource in the eastern part of the state. So we are, again, trained, and we have a lot of, classes that we have to take and webinars and so on to get this information correct. And we do that every day, so all day. So we have a lot of experience doing that. But people at the field office, they have to do other jobs, right? So a representative of Social Security, they might have to process documents, they might have to enter information into the system, they had to move forms in some way and check eligibility. And maybe they have other programs such as retirement programs, survivors programs. So they don't really live into the disability benefit area. They live in many others, activity they had to do. So when you are seeking information about benefit, it's very important to get those professionals that are certified and experienced in the field that can give you those answers. And this one, for example, like I said, going to the Social Security office and ask a question to anyone could be something very confusing. All right, let's move to the next misconception. Next. All right, so misconception 4. A friend told me I'm receiving SSI and I have 9 months to work without affecting my benefits. All right, this is a very common confusion and happens because when we are, okay, benefit is a very individualized system, right? So a person A, for example, might be receiving 3 or 4 different benefits, and a person B might be receiving completely different benefit. Now, they're both disabled. They both went to similar agencies, so they both went to Social Security. They both went to Medicare or Medicaid to get their benefit. So they think they have the same benefit. And like I mentioned earlier, when you are receiving disability benefit, you might be receiving different benefit from different programs. So for example, Social Security programs, I can mention there is the SSI program, there is the SSDI program, there is a retirement program, there is survivors program. There's so many different programs in Social Security. So if you are receiving benefit from Social Security, you might be receiving benefit from one of these programs. We have different rules, right? The other person might be, for example, one person A might be receiving SSI and person B might be receiving SSDI, right? So they're 2 different programs. They're both under Social Security, but they have different rules. This different program has different rules. So one program, for example, the SSDI has a 9-month trial work period. That is something that a lot of people heard about it and talk about it. But a person in SSI doesn't have that because Social Security doesn't give that work incentive to that person. Those are 2 different programs, work 2 different ways. So when you are maybe talking to another person with a disability about your benefit, just make sure that you're both in the same program, and then you can share notes and comments, right? But one situation or your personal situation might not be the same when the other person, and might create a little confusion, right? You just say, I have this 9 months, but you don't. I don't understand what happened. Or maybe you have this 9 months because I have them, but that might not be accurate, right? So again, that go back to the benefit counseling, right? That's where we're here to help you with those questions. All right, let's move into the last misconception.
I think Carla's having some internet issues, which is why it's dropping. Let me see if I can share my screen.
Okay. All right, perfect. Thank you, Yasin. So let's move into the misconception number 5. So another common misconception is once I start working, and again, this could be different agency, right? It could be Social Security, it could be DSS, it could be Medicaid, Medicare. So, or any other agency will know that I'm working since I'm getting a pay stub. All right. So I just wanted to mention that receiving benefit uh, have a lot of strings attached, right? And one of them is reporting your working activity periodically and timely to the agency that have or that is issuing that benefit to you. So eventually, yes, the information will be shared among agencies, right? So the information about earnings will come to Social Security in some way, right? Or the information to DSS will come to DSS in some way, in some point in the future. But in the short term, it's important to know that it's better for you as a person who's receiving those benefits, proactively go and talk to the representative and tell them that your situation, your employment situation has changed. You were not working before, and now you have a job, right? Now, normally with Social Security, that is not that complicated, but people tend to forget that, tend to forget about doing the reporting, and not reporting might bring you bigger problems. So it's one of those things that you want to avoid those bigger problems. So what are those problems? So first of all, and it's very common, you might have heard about the overpayment, right? The overpayment means, for example, if you're receiving SSI, SSI should be reduced with your earnings from employment. So you should get a little smaller SSI check. That is normal. There's nothing wrong with it. That's how it works. Those are the rules of the game. You had to follow that. Now, if you don't tell Social Security you're working, Social Security will send you next month the same check, right? Because they think you're still not working, but you're working, you're making money, right? And eventually, maybe the following month, the same thing, and again and again and again for several months, until in some point, either you tell them that you're working, or they will find out that you're working for because they have their interagency exchange of information, right? So at that point, what happened is say, oops, by the way, Pablo, you were working all this month, you didn't tell me. Unfortunately, we recalculate your benefit, right? They go back in time and they recalculate your SSI. I said, you owe me for the first month $200 and the second month $300 and and keep piling up and piling up and piling up. So you fall in what is called an overpayment, which means you have extra money you received while you were working, and now Social Security says you had to get that money back to me. And we had a debt with the federal government. So we want to avoid those situations. Those are really big headaches. We want to avoid falling into those circumstances. And again, the best thing to do is to report, right? So as soon as you start working, gather your of those pay stubs and go to the Social Security Administration and say, you know what, I started a job. This is what I'm doing. This is the number of hours I'm working. This is my pay rate. This is the name of the employer. They're gonna ask you some part of the information. I put it into the system, and they will give you some type of documentation saying that you did the reporting. So that is very, very important. A lot of people think that because they pay those taxes, right? Because they're getting paid, they get the deduction from Social Security and Medicare and sometimes state and all of that, they're done. That's it. You don't have to do anything else. Well, that is correct, but those deductions that you're getting there are for IRS purposes, for taxes purposes. But Social Security is the agency that is giving you the SSI, not the IRS. So that's why you have to go to Social Security and tell Social Security, by the way, I've been working. That's very important. Another problem that you might avoid is eligibility problem. So as you work, like I mentioned earlier, you're earning more money and you're accumulating resources, right? So most of the programs have some type of eligibility connected to income and resources. So, and that's something that you should discuss with the council, with your benefit counselors as well. So being eligible and remaining eligible for the program is very important. So that will help also to find out that you remain eligible for that benefit or not at that time. So that is another important point that you might want to check right away. All right, so I think we covered the most common misconceptions. Let's move into the next section now. Overview benefit counseling services. All right. So we want to try to put in very simple words what is what we do every day, right, as a benefit counselor here. So we want to start with the first question. What are benefit counseling services? So perfect, great, thank you. So benefit counseling services are individualized and personalized meeting with a certified counselor to discuss how employment activities can impact your benefit, right? This is overall. So the concept of the benefit counseling is you are receiving right now some level or some combination of public benefit, and you are receiving income, and eventually you are saving some money, getting some resources, right? So your eligibility for this benefit, right, that you have at the beginning might be impacted, might be different. It doesn't mean anything yet, it just means it is different. So we have to review your situation. We can do a lot of things we want to see in a minute in another slide. And the idea is to see how this employment activity can impact your benefit, right? And we do that through meetings, right? Like maybe it could be through a phone call. It could be done through a video conference. We can do it different ways. We can do it in person as well, if it's that possible. And we also use all type of multiple technology to assist with that. So we use the email for forms, mail, and so on. So there are different ways, and we put all that together, and we talk about the impact on your benefit. All right, let's move to the next slide. How can benefit counseling services help me, right? So these are the things that you can, in some way, expect or receive while you're meeting with a counselor, with a benefit counselor. Not all of them may apply to you, but those are options that you might have when you are meeting with a counselor. So first thing would be to review your personal employment and benefit situation, right? So the first question is, what benefit do you think you're receiving? Right, you're receiving SSI, Social Security, Medicare, Medicaid, food stamp, housing. There's so many benefits out there. Honestly, the list is very long. And also, what is your employment situation? What are you trying to accomplish? Are you trying to get a job right now? You get a job maybe the next 3 months. What are your possible outcome here? Where you want to make this amount of money and so on. So we're trying to gather this information and trying to put it together. We can also discuss a lot of information about programs, right? Benefit counselors are trained in programs, benefit programs. So again, we're talking about the SSI program, the SSDI program, Medicaid program, Medicare, and so on. And we can continue going and on and on and on and on. There are a lot of programs, there are a lot of agencies, there are a lot of benefits. So we can talk about that. This is what it is for. This is what you receive in this. This is the limit and income, and this is what you qualify for and maybe not qualify for in the future. So, and these are the possible benefits you can move into once you don't qualify for this one. So all the conversation can take place with the benefit counselor. We try to be as much specific as we can about the impact on your benefit. So the more information about your employment situation, the better. And I always suggest people to come not too early in the process, but not too late, right? So kind of like in the sweet spot where it's not too early that you don't know what you're trying to do. So ideally, you have an idea. I'm trying to maybe work as a cashier. Maybe I want to be working 15 hours per week. Maybe I'm going to be working, you know, in certain situation and I'm sorry, I think this slide changed for a second. I think I might have to go back and then thank you. I'm going to try to move faster now. I see the time. And so those situations, we try to be specific. Now, the next one is strategies to reach your employment goal. This is very important because we always ask for your strategy. What are you trying to accomplish with this experience? What are you trying to do? Are you trying to, for example, just get an extra money for something, right? Are you trying to save some benefit? Are you trying to keep all the benefit? Maybe you're not so concerned about all the benefit, right? So what is your strategy behind getting this job? And that strategy comes from you, and we help you to reach your goal. Employment and resources are released in the community. That is important. Sometimes people might need to get into some benefit, right? Because we see that the benefit situation is not strong enough. So we might advise you to reach out to DSS. Maybe talk about them about receiving food stamp. Maybe it's a good idea at this point. Maybe in the future you might not need it, but right now we think that you might benefit from talking to DSS about food stamps. Benefit issues. Benefit issues basically is when you receive a letter from the agency telling you that, for example, your SSI has been suspended. You're not getting that SSI check anymore, right? So in that situation, you have an issue. We have to see what's going on. Or maybe you go to the doctor and get Medicaid, tell you Medicaid is not covering these services for some reason, right? So it might be another issue. Normally the benefits issues come from you don't get the benefit, something is not working right, or maybe you get a letter from the agency telling you that you had to do something to change your situation, right? Those are common situations. Work incentives, we talked already about work incentives. Those are special rules that allow you to keep your benefit for some time. Very important when you discuss it with your benefit counselor. And any other issue related with employment and benefit. Next slide, please. I'm trying to go a little faster here. When is the best time to request assistance from a benefit counselor? That is important. So like I said, there is a sweet spot. If you come to the benefit counseling services too early, there is no specific information on your employment. So it's not personalized enough. But you don't want to come too late when you're already in trouble, right, with your benefit. So you want to kind of be right in the middle, maybe when you are kind of you went through the assessment process, the job exploration, the job preparation stages, and you're kind of ready. So you might want to have an idea of how your benefit would be impacted at that time. Also, it could be when you're just starting your job. When you just started working, you might be 1 week, 2 weeks in. Now is a good time to get and reach out to a counselor. When you're trying to make informed choices about employment, again, when we move into this process and trying to see if employment is a good option for us, I think benefit counseling is very important to have a good understanding of your programs, a good understanding of your limit and income resources and resource limits, and so on. So that is very important as well. And the possibility of losing benefit is important. So when you're worried about losing your benefit, that is holding you back, right? A lot of people get held back because they don't know how the benefit will be affected, and they just don't move forward there. They just want to stay there. I'm afraid to lose my benefit. I need to have this conversation with someone. That's when a benefit counseling is a good time to access benefit counseling. And if you're experiencing benefit issues, as we discussed earlier. All right, next slide. Who provide benefit counseling services in North Carolina? So again, benefit counselors are provided by certified professionals. And this is very important. I want to emphasize that. Try to get in contact with someone that does that consistently. It's a person that is certified and is experienced and has been doing this for some time. So because this is, it's like kind of riding a bicycle. If you ride a bicycle every day, it's easier to keep riding your bicycle. If you haven't ride a bicycle for a while, sometimes it's just hard to get back in, right? So benefit counseling is similar. So if someone is doing this job for some time, it's easier to get back and ask those questions quickly and get different information for their program. If the person was certified maybe back 5 years and doesn't remember everything, hasn't done it, might not be fresh in their mind all the changes in benefit counseling. If you need explanation, you need simple explanation about complex information about benefit. That is very important. That's when you wanna reach out to a benefit counselor, and benefit counselor can do this for you. And when you need to develop the strategy about your benefit counseling, right? So that's what the benefit counseling does. Help you to develop and refine that strategy so you can move forward with your employment decision. All right, let's move into the next slide. All right, so common benefit, I want to talk about the common benefit programs, and I have a minute here. So as I mentioned, Social Security funds one of the largest or most I would say oldest program that has been around in the country, and it's called the Work Incentive Planning Assistance, or WIPA. A lot of people heard about the word WIPA. So this is specifically for Social Security beneficiaries. So you have to receive at least one Social Security benefit, right? Now, as I mentioned, EIPD is doing the western part of the state. Services is doing the eastern part of the state. There are two providers in the state for specifically for this program. There is another program called EIPD Fee for Service program that is specifically if you are already enrolled with vocational rehabilitation or EIPD, you can discuss that with your counselor. So, at this point, I would like to have a counselor, a benefit counseling services, and they also can have partners in the community, and they can refer you to those partners. Benefit counseling under the innovations waiver. So this is a new, the innovation waiver was recently reauthorized, and they added the benefit counseling services under, under the waiver. So if you're in a Taylor plan and you can access benefit counseling, you have to talk to your LME MCO to get those referrals for benefit counseling. This is specifically for people in the ADD community, right? They're private counselors, so like I mentioned, you might find people in the community they are providing benefit counseling in a private way. It's digital arrangement, they might have a fee, they might do it for different reasons, and that's a possibility. And there are other programs there that might be, for example, pilot program, the Spark program is in the community. If you are in one of those counties and the Spark program is available to you and you want to enroll in the program and so on, you might also have received benefit counseling services through those programs. So there are many, many different ways to get it. If you have questions, you can reach out to ServiceSource. We are glad to help you and guide you with that process. And I think that is my last slide. I want to turn it to Austin and Kina right now, right? Is that correct?
That's correct. Thank you very much, Pablo. So now we have reached the Q&A portion. We have Kina here from Employment Source as well to help answer the questions from your chat. Kina, do you want to give a quick intro?
Yes, hold on. Yes, I do. Hi, good afternoon. My name is Kina Farrington, and I am one of the CWICs here at ServiceSource. I've been working in the CWIC position probably about 9 years. And I'm here to answer all your questions that you may have. Just want you to know that some of the questions may be more individualized, and we'll talk about how to access our services for future reference, okay?
Sounds good. So the first question in the chat is, what is the best way to advocate for a family member who has IDD and wants to work? Should he start with his local MCO?
Yes, that would be one of the ways. Also too, if they would like to contact the Ticket to Work helpline as well, or vocational rehabilitation services too.
Yep, the MCO will likely refer that individual to their local EIPD office if they've not used those services before. The next question is, could you please explain the definition of creditable work?
Well, what they mean by that is any employment, any wages, any employment that you have and you get paid wages, Social Security will say that those are countable, that's countable income. And any of that income could possibly count against your Social Security disability benefit check.
Thanks, Kina. Our next question is, do EIPD counselors know about 1915I? Is it better to apply for help through 1915I or apply and then ask about how 1915I will impact the help you can receive? I believe we have some folks from EIPD on the call who could maybe answer that question.
Yeah, because I'm not real familiar with the 1959.
But EIPD counselors should be knowledgeable about the service package under 1959 waiver. But if there's somebody from that department who could speak more about it. Yeah, Adrian.
Sorry. I was having a hard time. I don't think I could get off mute. So can you repeat the question?
Question was, do EIPD counselors know about 1915I? And then what is the best way to get help through 1915I? Is it to go through EIPD or go directly?
To the LVMCO. So typically our process, we would want an individual to come through EIPD initially for services. So often we're connected with students who are still in high school, and they would go through an array of services with EIPD. If someone requires supported employment services, which is a service offered through our agency as well as under 1915I, then we would help facilitate that when someone is served by us. So EIPD covers the initial supported employment to help someone look for a job. And then we have a period of intensive training or job coaching that we pay for. But at some point after an individual relationships with supervisors, then we would help the provider transition to long-term supports through the LMEMCO, and that could be 1959, or it could be Medicaid or Medicaid waivers, supported employment services, or potentially state-funded services if those are available. But we would help people transition as our services are ending. Does that answer the question?
I think so. Thanks, Adrian.
Yep.
Our next question is the 9-month incentive to work program the same as the ticket to work program?
No, it is not. Actually, the Ticket to Work program is a program that's basically designed to assist you with finding employment, helping you to reach your employment goals. You may receive some type of on-the-job training. Also, too, you may receive referrals out to other agencies that can assist you too as well. Now, the 9 trial work period months, that's given to anyone that receives the SSDI benefit. And it's only for the SSDI folks, not the SSI program. So the first time that someone, after they start receiving the SSDI and they choose to go to work, Social Security will give them 9 months to work and earn an unlimited amount of money and still continue to receive that SSDI benefit. So no, those are 2 totally separate programs.
Thanks, Kina. The next question is about transportation being an obstacle. It is a major obstacle for employment for some individuals with IDD. And right now, direct support staff sometimes don't transport the individuals because they're not being paid. So this individual is asking, are there any other transportation resources available? And are private paid services able to be expensed when determining the total? So I know this is something that the department is currently looking into. It's currently part of the supported employment service definition, but I know the state is exploring additional resources for transportation as it relates to direct support professionals and that reimbursement. If there's others on the call who have additional context to add there, or from a benefits perspective, Kina, if you have anything to speak to about transportation.
Yes, usually, like I said, with the transportation piece, basically we just encourage the beneficiaries to try to find specialized transportation services in their area. And I know that's definitely a chore sometimes to do. But the one good piece about it, If you go out and you pay for your specialized transportation, for most cases, let me not say all the cases, but for most cases, Social Security will allow you to deduct the transportation costs from your accountable earnings so that it shows that you're earning less money than what your gross amount of pay would be. So that's one thing definitely, if you choose to participate in benefit counseling, we definitely can go over all those, we call them impairment related work expenses.
Thanks, Keena. That leads into the next question, which is the 1550 SSDI threshold for all income or just earned income? And is the SSDI cash payment included in that amount?
Let me answer the second question first. When, for the folks that receive the SSDI, no, when they go out to work, and if they go out and earn the 1550, that's only from total wages. It does not include the SSDI benefit in addition to the wages. And what was the first question? I'm sorry.
Is the 1550 SSDI threshold for all income or only earned income?
Yes, it's for the earned income for the SSDI beneficiaries.
Thank you. All right, looks like our last question here. Do you have to see a vocational disability agent first before getting counseling through WIPA?
No, you do not.
All
And
right.
you can talk about the process more or less. I mean, in this case, I'm sorry, just gonna add that if someone is looking for the WIPA services, they can contact directly to us in this case. Or if they live in the eastern part of the state and they live in the western part of the state, they can contact the EIPD, and they have a separate unit that does the benefit counseling. So you can go directly there and receive services from them.
Thanks, Pablo. I am going to turn it over to Tina to wrap up with our last slide.
I hope that I pop up and that I come on volume. I also had some technical issues. So we'd like to thank everybody for joining us today. We do appreciate you being here. Our second session will be on December 4th, and that will cover navigating benefits and employment, some real world experiences. We encourage you to register using the QR code. There's also a website that you can go to click on to register for that as well. And we look forward to seeing everybody on December 4th. Thanks for being here.
Thanks, everyone. Just a couple more QR codes for the InclusionWorks website, and if you'd like to join our mailing list as well. So please reach out if you have any questions. Thanks, everyone.
Okay, thank you. The
Thank you.
recording and presentation slides for today's event will be posted on the InclusionWorks website. The link is included in the chat. Please join us for part 2 of this Lunch and Learn series, Navigating Benefits and Employment, Real World Experience. It will be held on Wednesday, December 4th at noon, and we hope to see you there. There will be a brief survey following today's webinar, and we would appreciate your time completing it. This concludes our webinar for today. Thank you for attending.